Hey guys, it's Amy here at Nourish. I wanted to hop on to talk hormones. Now, hormones are super important for men and women, and they can contribute to a lot of symptoms that people wouldn't think about. I was a patient first when I realized that my testosterone was actually low and was contributing to my joint pain, my brain fog, my fatigue, and I found how optimizing my hormones benefited me so much that when I opened my own practice, I brought that in, and that's a big part of what I do. Hormones are so important for men and women. Everybody thinks of hormones as just a female issue, but it's not. Same with testosterone. Everybody thinks that testosterone is just a man hormone. It's not. It's important for men and women. Hormones, as they fluctuate, they can cause fatigue, mood swings, weight gain, joint pain, insomnia, brain fog, low sex drive. For women with estrogen deficiency, it can cause vaginal dryness. For men with testosterone deficiency, it can cause erectile dysfunctions. It just throws your body off. Women by age 40 lose 50% of their testosterone production. And as they enter menopause, their estrogen just goes in the tank, which then also gives them those horrible symptoms that everybody talks about with menopause. Men ages 30 to 70 can lose about 1 to 3% per year in their testosterone production alone. And that is huge. And especially during that time of our lives where we're the busiest, nobody wants to feel like crap. There are also a lot of bad side effects from having your hormones imbalanced, especially like testosterone. For men and women, you have an increase in insulin resistance, increase in insulin levels, which equals increase in blood sugar. You can have increase in your lipids, which can mean higher risk of cardiac disease, heart attack, strokes, increase in abdominal fat. For women, low levels of estrogen can contribute to cardiac disease, osteoporosis, and even contribute to cognitive decline. There are many options out on the market for hormone management, but I kind of wanted to touch base on why we do what we do here at Nourish. We focus on what's called bioidentical hormones. Bioidentical hormones are different than what you go to like your OBGYN for the most part, or your main doctor, and they prescribe you the creams, the shots, the vaginal gels, all that. Those are synthetic hormones. Those are not chemically similar to what our body naturally produces. A lot of times they're made from chemicals, and shockingly, women, estrogen can be made from pregnant horse urine. Gross. For bioidentical hormones, which is what we do, they are very structurally identical to what our body actually produces, and they are made from soy and yams. When we look at bioidentical hormones, we also focus on how do we get them to the patient and to the source. With a lot of big pharma and the commercially prepared hormones, you can get oral versions, but with oral versions comes GI upset, nausea. It can be very hard on the liver. You lose a lot of that hormone with the first pass effect, which is where it's metabolized before you can even get the active form circulating in your system. It requires daily or even multiple times a day dosing. It's just not the favorite for people. Then you have injectable, like your injectable testosterones that people are prescribed. The thing with that is it can make you feel better, but it can also make you feel worse. And that can happen very frequently because there's not a steady state in your bloodstream. You have a sharp peak and then it just drops off, and then you have to do another injection. You can have pain with the injections. A lot of people are actually allergic to the suspension that the hormone is in. Men have a much higher incidence of what's called aromatization, which is where that testosterone is actually converted to estrogen, and no guy wants that. And it can also increase platelets and their viscosity, which can increase the risk of a cardiac event. Then there's the transdermal, which is skin or even vaginal preparations for hormones. That can cause a lot of skin irritation. Some sources say that up to 45% of people don't even absorb the hormone well. And a lot of times it has multiple administration times. We also see that blood levels really vary person to person. And the biggest thing, especially with the men, is having it transfer to other people. You don't want to have testosterone on your skin and then touch your wife or touch a child because that can transfer. At Nourish, we focus on bioidentical hormones, and how we administer those to the patients is through what's called pellet therapy. Pellet therapy is basically what it sounds like. They are tiny little pellets. They look like rice grains of rice. Some are a little bit bigger depending on the dose. And we place them in the fatty tissue in the upper buttock, not in the muscle, not superficial to where you'll feel it. We make a tiny little incision after we numb you up with lidocaine, put them in, put a steri strip, a bandage on, and you're good to go. They absorb much better than the other forms of hormones out there because it's a much more consistent blood level. It's a slow release of hormones over a period of time. For women, estrogen and testosterone pellets can last anywhere from about 3 to 4 months. For men with testosterone, because they get much higher doses and the surface area on the pellets are bigger, they only get pelleted like twice a year, every 5 to 6 months. There's minimal pain with insertion because we numb you up, and they're just a lot more convenient because you're not having to take it every day, you're not having to do shots, you don't have to do all that. The biggest thing is just seeing if any of this is right for you. Typically, you know, I've even seen people like myself in their 30s who benefit from hormone optimization. The first step to see if this is even right for you is just getting a lab panel drawn. The cool thing about us here at Nourish is we have a lab draw on site, so we can draw your blood. We are able to run that blood panel through insurance, or we have cash pay prices, which are really affordable. And sitting down and talking with me to go over your symptoms, your health history, like what's going on. So that way we can piece it all together when your labs come back to see if we can help you with that. So come check us out, give us a call. We'd love to sit and visit with you. And until next time.